Now, Omicron has been reported in countries in Europe and 2 cases have been confirmed in the UK as well. This as governments around the world are scrambling to try and stop the spread of the new variant. Prime Minister Modi has asked officials to review the lifting of international travel restrictions as several states now announce stricter measures in the light of the new variant. Experts say it is more transmissible and could even infect those who are fully vaccinated. To talk more about this variant, we have Dr. Aishta Dwivedi joining us from New York. She's an assistant professor of medicine at the Lenox Hill Hospital, Northwell. Thanks very much, Dr. Aishta, for being with us. Everyone around the world is really spooked as a result of this new variant. The US, along with several other nations, have already imposed a travel ban. But there are several experts who believe that this is too late. The variant's probably already, spread to different corners of the world. How are you looking at these developments?
Hi, Rishika, and thank you for having me on the show. You're absolutely right. I think it's not a surprise that we're continuing to see more variants. But the reason this is a variant of concern as defined by the World Health Organization is because it is known to have more mutations on the spike protein. And the spike protein is what really helps the virus get into our body and also is associated with the immune response that our body generates. And that also plays into effect of the efficacy of vaccines that we have. So this is obviously causing very appropriate concern around the world. I do think we have to wait and see how much transmittability this virus has, how virulent this virus is, and we already know that it has more mutations than Delta virus. But I think this just calls into effect that we have to reinstate, social distancing measures, mask mandates, and encouraging people to follow things that work. And I think in the meantime, as we learn more about this virus, we have to remain cautious, and also calls into the need for people to get vaccinated, as we know that, vaccines are effective, and the more people that get vaccinated, the less chances there are of the virus to mutate into more variants as well.
All right. It's important that you stress on vaccination. Dr. Rajesh Parekh, the Director of Medical Research, Jaslok Hospital, Mumbai, is also with us. Dr. Parekh, I want to ask you, a short while ago, we also heard the Vice President of the United States, Kamala Harris, while, meeting people over Thanksgiving, she said, urge people to go out and get booster shots. And this is this is like a public appeal that she's made. Is it a wake-up call? Is this new variant a wake-up call for India to consider giving boosters, given the fact that there are several questions over vaccine efficacy against this new variant?
Oh, absolutely. Good morning, Rishika. And it's the latest in a series of wake-up calls, some of which we have heeded and some of which, sadly, we have ignored. But regardless of this, it was about time that we got into the Boosters Act in answer to your specific question. But if I may, I have been tracking this variant for the last 5 days. It's been keeping me up. And I could just share a graph with you because, it might speak more loudly than words to convey to our viewers why this is a variant of concern and why, as you say, it's not just a wake-up call, but maybe even more than a wake-up call. Yes. Now, if we look at these graphs, let's just pay attention to the first line here. This is the new variant, Omicron, as it has been christened by the WHO. And if you look at its infectivity in terms of the percentage of new cases in South Africa, and then compare it with the Delta and the Beta variant, I think it's quite clear by now that it is highly infective. We must never forget that we are 1 or maybe even 2 steps behind the virus at all times. So we can make certain conjectures and have them validated as we go along. But what seems very clear right now is that it is highly infective. It possibly may be more lethal, and it's dealing with the virus. It may be more efficient, which might make the virus, more virulent,
yes,
even in the vaccinated people. And that's why it's very important to get in our country, first of all, the second doses,
Yes.
and of course the boosters.
But how does this affect the US and Europe particularly? Dr. Aishta, if you'd like to come in here, because, we saw the New York governor, for instance, declare put out an emergency declaration over high rate of infection because of COVID. And what we so far know is that Europe and the US are still battling the Delta wave. Does this spell disaster?
Yes, Rishika, I think we have seen the number of cases go up in the United States and Europe within the last few weeks. And the reason remains multifold. I think that obviously more people need to get vaccinated all over the world. That goes without saying, because we are seeing that most of the deadly infections do occur in the unvaccinated. Now, having said that, with the winter coming around the corner, winter's already here, Thanksgiving, holidays, people are going to be, gathering with families, friends, and this all creates a very high risk situation for the virus to transmit. And especially when you have unvaccinated people, the chances of the virus transmission goes up even more. And on top of that, you add this new variant. I think that it is a time to remain very cautious. It is a time, I know a lot of people are experiencing pandemic fatigue, but it is a wake-up call in the sense that we need to go back to what we know works, which is wearing masks, trying to socially distance as much as possible, avoiding areas that may have high transmission, like indoor gatherings with poor circulation, and vaccination remains, the main component of preventing transmission as well. So I think that the New York State did call a state of emergency. It is a cautious measure, because they do not want to reach that stage where what we had earlier last year, where hospitals were inundated with COVID infections.
Well, absolutely. And this is, in the back of the fact that the US is already seeing a surge in daily cases. But Dr. Parikh, coming to the point, on what India needs to do. We haven't imposed a travel restriction on South Africa. We haven't joined, over 20 nations now have travel curbs in South Africa. Many experts have questioned the rationale of this. India hasn't done that just yet. But in the light of the COVID clusters that are emerging, there are news of clusters emerging in Karnataka. There's now news of a latest cluster of 25 students testing positive in Orissa that's just coming in. In the light of these clusters, do we need to step up genome sequencing to better be able to understand what's happening? Because we're suddenly also reporting clusters in a span of the last 10 days, and we've seen a gradual dip in COVID cases in India.
Oh, absolutely, Rishika. I couldn't have put it better. I've been saying this for the last 2 years. We need to continuously ramp up our testing and continue surveillance. But more important, Rishika, I cannot help emphasizing this enough. We need to get on both with our second doses. There's a huge chasm between the people who've not taken the second dose. And we need to start with our boosters, not do this in sequence. Both need to go simultaneously. But if I may just add a bit to what Dr. Dwivedi said, we're seeing the emergence of a war of words. It's a little quiet now, but I'm sure it's going to get amplified in the days to come. Banning of flights from the US. And, the African nations are now not only protesting these bans, but are pretty much saying in words that this serves you right. Vaccines have been hoarded by the West. Africa has been deprived of vaccines. I've been saying this for over a year, that this is going to go around as long as some of us are unsafe, all of us are unsafe, as long as less than 24% of Africa is vaccinated, we cannot be smug. One of the principal reasons why variants are thriving is that it is amongst the unvaccinated. And I think in doing all this, it is also in our enlightened self-interest to help out Africa as quickly as possible with the vaccination.
All right. Well, it's a story that we're going to continue to track here very closely. As both the experts have just said, this is a cause of concern. The WHO has, of course, raised an alarm from a variant under monitoring. It's directly gone to a variant of concern. There's a spike in cases in South Africa that have people believe that this variant could indeed be more transmissible. So get yourself vaccinated and, of course, continue to practice social distancing and masking. That's really all we can do at the moment.
Absolutely.
Thank you both very much for joining us.
Thank you, Rishika.